Welcome back to part 4 of this very interesting case. So we saw John 3 months after for a post-op check. He was delighted, and of course that always makes me happy. And we took some photographs, and let me show you what they look like. So we took an occlusal view of the patient's mouth, and we can see there was a little bit of composite that had broken away. We repaired that, but the tissues looked nice and pink and healthy, and the bleaching that the patient had done allowed a much better aesthetic outcome and blending of the tooth color in an occlusal view. Just by way of comparison, have a look at this view, and now we'll show you what the case looked like when we first saw him. So this was John a few months prior to the work that we did in his mouth. So this is the right side view of the patient's mouth, and you can see beautiful gingival health and that the papillae are growing nicely down, and this will continue to improve over the months that unfold. This is the left side view of the patient's mouth, and once again, beautiful pink healthy tissues. And finally, front side view of the patient's mouth. The patient was delighted with the outcome. And let's just compare this to what the case looked like at the outset. So just to remind you of what John looked like on day 1. So there you have it. This was a step-by-step process in terms of how you treat an advanced case like this. I hope this has been very helpful to any of my fellow clinicians. Please feel free to ask us questions, and like and subscribe if you want me to send you more notifications of upcoming cases. Remember that these difficult cases is just a jigsaw puzzle, and pieces have to be moved around so that you get the perfect outcome.